But this is the basis by which for your research projects or your thesis, once you finish MBBS, you do your MD, MS, whatever. The basis of your thesis will be experimental epidemiology, not a cross-sectional or descriptive study in most cases. Okay, so before going to experimental epidemiology, just a brief recap. What is epidemiology? You know this. Study of determinants and distribution of health in specified population and the application of the study to the control of health problems. This is epidemiology. This you know. The components of this are disease frequency, determinants of disease and distribution of disease. Epidemiology is distribution, determinants, disease frequency. Okay, 3 Ds. Again you have types of studies, observational studies which include descriptive and analytical includes case control and cohort. Experimental studies on the other hand, clinical trials, field trials, community trials. Just remember this, clinical trials, field trials and community trials. So what exactly is a clinical trial? What exactly is a clinical trial? Any idea? What exactly is a clinical trial? What do you mean by the word clinical trial? Take a guess, what is a clinical trial? What is a clinical trial? You studied pharmacology, right? Yes or no? Yes or no? Pharmacology is Which is your favorite antibiotic? Which antibiotic would you like to take? Which is your antibiotic you like to take? If you have a problem, which antibiotic? Just say some antibiotic. Huh? Ciprofloxacin. He's saying ciprofloxacin. What about you? You use ciprofloxacin or something else? Huh? Amoxicillin. Okay, she's saying amoxicillin. So everybody's got his own idea of the medicine. So in the clinical trial is something different. You are giving the medicine as something which is probably opposed to what. So he feels like ciprofloxacin and he is doing it as per some preset guidelines. You are saying that no, amoxicillin given 4 times a day may be as good as ciprofloxacin given twice a day. That is a clinical trial. Okay. Or you may say some other drug is amoxicillin along with something else will be as good or better than ciprofloxacin. That is what is clinical trial. So basically, in clinical trial or in experimental epidemiology, the investigator intervenes. Observational cross-sectional study, there is no intervention at all. You just observe, you make a table and all these things. But here what you are doing is experimental study. Yes, if it's an investigator intervened. Second thing is random allocation. That's very important. Random allocation between the groups. Okay, and then if it is there, it's called randomized control trial. If it is not there, it is called a non-randomized control trial. So when the investigator intervenes, when it does something, that means that is a experimental trial. So experimental epidemiology. Now observational trial study, researchers don't have any control over key variables in the study. You are doing a study on say malaria or mosquito-borne diseases in a rural population. You don't have any control over the study of the variables. Okay. An experimental study, you have control, you can manipulate the variables in experimental study. Okay. Now, here, what does the investigator do? He makes one group exposed to the particular thing which is going to control. Other group is not exposed to the thing which is not going to use. Okay, so that is a control group. Say for example, the example which I gave, he is giving ciprofloxacin, but the other group you are not giving ciprofloxacin. After 7 days, you are seeing the response. What is the total count? Has the fever subsided? Have the other things subsided? So, one is giving a medicine and the other is a control group where you are not giving that particular medicine. Okay. So, exposure, individuals are assigned to a group and exposure is forced on them. Okay, now the question is, exposure is forced on them. How do you force it? Suppose I say, I'm doing a study on some new drug. I say that the boy should be given this medicine, but the girl should not be given this medicine. So I'm forcing it, but that is not correct. So you have to make it sure that it's randomized. There is no bias. Okay. So it should. If I give a drug, I'm doing a new drug, say some multivitamin sort of thing, which is there. So I'm giving a random allocation that medicine may go to either a boy or a girl. It's not that it goes to only the boys or the girls. Okay. So that is randomization. So you have a treatment group versus no treatment group or a control group. Okay. So the outcome is the crucial outcome is the outcome in the treatment group as well as the control group. That is the most important thing. And groups are treated identically except for the intervention. So remember this, groups are treated identically except for the intervention. So here experimentation involves attempting to change a variable in one or more groups, such as deliberate application or withdrawal, okay, of the suspected causes, or changing one variable in the causative change in the experimental group while making no change in the control, and observing and the control, comparing the outcome in both the groups. Okay. Now, when we were interns, when I was an intern, after we used to write discharges of patients. And like you people also will be writing. So at the end of every discharge, some of our seniors used to say, give multivitamin. So the patient's got appendicectomy. Done. This. Last time we used to give multivitamin. Another person, medicine also, he's also giving a multivitamin. So the question is, why multivitamin? So multivitamin was given to everybody those days. But we didn't know what it was. Okay. That was it was given to all people. So the aim is to provide scientific proof, to provide a method of measuring the effectiveness and efficiency of health services for prevention of control and treatment, and improve the health of the community. Now, before doing human experiments, there used to be animal trials. Okay. Animal experiments on dogs, guinea pigs. Guinea pigs and dogs are the most important ones. Then, so that you see how the medicine is there, and rats, guinea pigs and dogs, particularly with cancer treatment. So, for that, you need a lot of testing. Then after animal trials comes the human trials. The human trials is a different entity altogether. You have to look at safety also. Okay. Before any drug is given to a human, you have to look at the ethical aspect. You look at safety. Usually, human trials are not given to pregnant women or lactating women or children. Okay. So, the benefits have to be weighed against the risk. Meaning, it's a trial kore labh taki na ki khoti hobe, which is more important. So you have RCT and non-RCT. RCT is randomized control trial, which includes clinical trials, field trials, community trials. Non-randomized is without control and natural experiments, and before and after comparison. Now, each one of this will be discussed in some detail, but the most important word is randomized control trial or RCT. RCT is in three forms: clinical trial, field trial, community trial. Non-randomized is trials without control, natural experiments, before and after comparison. So, what is the population you're doing? You're taking the population here. This is a full population. Then you're taking the eligible population. Then who are exposed, and here there is drug is given or not given, and again who are not exposed, and then you do a follow-up. Okay. So, for example, breast cancer using tamoxifen. We know tamoxifen is a drug that is used for breast cancer. So that is done basically on the basis of experimental epidemiology. First is, there are certain steps in doing a randomized controlled trial. First is protocol. Second is selecting reference and experimental population. Third is randomization. Fourth is intervention. And fifth is follow-up. Okay. And sixth is assessment of outcome. First is, you have to develop a protocol. What exactly are you trying to do? This. Second thing is selecting reference and experimental population. Obviously, you can't, if you're planning to do a study in India, there's no point doing a study in Africa and explaining it to the Indian population. You have to do a study in India. Third one is randomization. Fourth one is randomization will be taught in some detail. Intervention, follow-up and assessment of outcome. So protocol. First here is, who are you going to choose for study? What is the sample size? Okay, and what is the treatment to be applied? All this has to be clearly specified. Now for example, say some treatment which says you give topical steroids instead of oral steroids, or topical steroids in this strength, 5% of this topical steroid. Another study says 10%. So that is, you have to criteria for selection of study groups, control groups, size of the sample and treatment to be applied. This should be clearly mentioned. Once the protocol has been evolved, it should be strictly adhered to. You should not change the protocol. You should not change the protocol means, sir, I wanted 100 people but only 50 people came. You cannot. If you have said 100 people sample size, you have to do it on 100 people. You cannot change it to 50 people. So it should be strictly adhered to. And pilot study is usually done to find out the feasibility of the study. Pilot study means a small study in some small group which can be done to find out the feasibility of study. Next is selecting experimental and reference population. Obviously, any study you cannot take the whole population of the area. If you want to do a study in Birmoor, you cannot take whole Birmoor. You want to study in Bolpur, you cannot take the whole population of Bolpur. You have to take a sample. Okay. So reference and experimental population. Reference population is the population to which the study, findings of trial, if found successful, are to be expected to be applicable. That is the reference population. And experimental population is, they should be eligible for the trial. They should give informed consent. Now, for example, if I want to do a study on students, say BMI among students, BMI among degree students. My study is just BMI among degree students in Bolpur. How will I go about it? BMI among degree students in Bolpur. For which will be easy for me. BMI, I'm studying on body mass index among students, degree students in Bolpur. Which is easy for me. Kiva korbe. Huh? What would be the experimental population if I want to do a study? If I want to do a study sitting in Santiniketan Medical College on BMI among students, okay, just BMI among students, what would be my experimental population? What could be my experimental population? Yes, absolutely. Santiniketan Medical College would be the experimental population. I just mentioned degree, okay. But the reference population can be applied to whole of Bolpur, possibly yes. But my experimental population will be Santiniketan. Why? Because it's easy for me. I cannot go to Vishwabharat every day and collect the data. It's easy for me to collect the data from Santiniketan. So, experimental population is a smaller population. They should be eligible for the trial. They must give informed consent. Reference population is to finding the trial if found successful and expected to be applicable. Is it clear? Experimental population is a smaller population, but they should give consent and they should be eligible for the trial. Reference population is a larger population and that's it. Okay. Next is randomization. This is the heart of the trial. This is an attempt to eliminate bias, and here the investigator has no control over allocation to either study or control group. Okay. Now here, what do you mean by randomization? I take a small packet of medicines. Okay. I give him one. I give her one. I move here, I give him one. I move here, I give one. I give him all of them one. I give all of them a packet. That packet, it may contain medicine. It may contain nothing. Okay, so that is called randomization. You are, it is, nobody knows. I also don't know what is in that. Only you will know. When you see that, you said, I have not got the medicine. You say, oh, I have got some medicine, maybe multivitamin, maybe something else. Okay, that is called randomization. So there is no bias that way, it's just random. So participants patients are randomly allocated to receive or not receive a specific intervention. Okay. So to help patients, groups are similar. Subjects are randomly assigned to experimental or control groups. So this is done to increase the likelihood that groups are matched in other non-experimental ways. Now, randomization does not assure that the groups are same, but groups are matched. Now, you can also do randomization from a random table. You pick up a number from here. Anybody picks up a number? You pick up, say, 76. You pick up 76 because 76 is your roll number. So I give you a packet which says 76. Somebody else picks up, say, 45. He gets a number which is 45. Then that's so on. So this is a random table. Anybody pick this number and you'll get that, you'll be allocated to that particular group. Okay, this is a random table. Then comes the manipulation. Here's it's important. We intervene by deliberate application or withdrawal of the suspected risk factor. Control group, there is no treatment. We are using placebo. What is a placebo? What is a placebo? What is a placebo? Huh? What is a placebo? What is a placebo? Anybody? You passed pharmacology, what is placebo? Huh? Yeah, and something which does not have any action. Okay. So you have a study group, you are giving them a new medicine. Control group, you are giving them a placebo. So the intervention, which is a drug or the vaccine or a new procedure, is called independent variable. And the final outcome constitutes dependent variable. Now remember, intervention can be either a drug or a vaccine or a new procedure. For example, now robotic surgery. They say robotic surgery you can use for everything. But the side effects of robotic surgery we are not yet familiar with, it's just coming up. So a new procedure, robotic surgery versus conventional laparoscopic surgery or versus general open surgery. What is the benefits? So record keeping and follow-up, examination of study and control groups at regular intervals, findings recorded till final assessment of outcome. Here there is a possibility that there can be attrition. Attrition means patient is lost to follow-up due to death, migration, loss of interest. Say you are doing a study on laparoscopic cholecystectomy versus open cholecystectomy. So you are following up the patient for 10 years. Some of the people are very old, they will not be interested in it. Some of them may have died. There may have been migration also. Okay, so record keeping and follow-up. Then you do a assessment after tabulation of data by means of statistical significant test. Positive results means a decrease in the incidence of disease or improvement of the patients. Negative results can mean death or side effect of the drug. So it doesn't mean always that a new drug will be very good. Okay, like when we were studying, we had some very basic drugs. Then a lot of new drugs come. But now we are finding many of the new drugs, they have side effects. A lot of problems have occurred in many areas. So positive result means decrease in incidence of disease or improvement of patients. Negative results are side effects of drug or death. So here there is another word which is called bias. Bias is there can be observer bias. The other one is subject variation. Okay, there can be variations from subject to subject. That is also taken care of. Now another term is blinding. Blinding means the investigator, subject or both do not know what group the subject is assigned to. That means when you get a number, you have picked a lottery number 76. I tell you, you go sit there. You don't know what that group is. Okay. That group may be getting a drug, may be getting a placebo or whatever, but you don't know that. Go sit there. I also don't know. I am just following the instructions. So both of them do not know. It's called double-blind trial. And this prevents people from being treated differently in any other way, okay, than the treatment itself. What do I mean by this? That there may be certain things which can affect us. In the sense, somebody is moving very slowly that side. Maybe he's got a problem with his legs. So that is something. So that this is, when you're doing a blinding study, it means the subject does not know, nor does the investigator know which group the person is being allotted. Okay. Just like something like your university exams. Okay. What happens in university exams? Let me tell you first what happened in our university exam many years back. I studied in Calcutta Medical College, and for every MB, we had 3 MBs those days, first MB, second MB and final MB. For every MB, 50 of us would go to any other medical college for externals, for the Viva. Okay. That means I would go to RG for first MB, I would go to National for second MB, I would go to NRS for third MB. So we are getting an absolutely neutral playing field. External examiner has not seen us, we don't know him, he has not taken our classes, no internals. The internals which are there are the internals of NRS medical college. They have not seen us. So it was totally a different situation in those days. Then gradually it changed. Now what is happening? Your theory paper, mind you, your theory paper is going outside. Nobody knows who the theory paper is going to. It may go to somebody in medical college, it may go to somebody in Durgapur, it may go to somebody in North Bengal. So that person is just seeing the roll number, doesn't know the name of the college. That is also an example, you can say an example of this. The only thing we are seeing is when the Viva and the orals come, that is the time. So during our time, it was completely a neutral, you can say double blind sort of thing. But your time, you have only the internal assessment is being done. Your theory is going outside. Okay. Then regarding blinding, single blind, the participant is not aware. Double blind is, both are not aware. Triple blind is, even analyzer is not aware. So nobody knows. We do the study and then it goes to somebody else. That person was the only person who knows which group gets what. Okay. So you have a single blind and double blind. Usually we have a double blind study in most cases. Triple blind is not very common. Just to keep the sanctity of the study or the particular thing of the study, that is, it is correct. Okay. Now another study design is called a crossover design. Now what happens here is you have group A and group B. Group A receives treatment number 1 and then treatment B. Group 2 receives treatment B first and treatment A. So what happens is crossover. Now what happens in the crossover is that he is getting both the treatments but in different schedules. Group A is getting treatment A first, then he is getting treatment B. Group 2 is getting treatment B first, getting treatment A. So it actually helps you if there are 2 drugs and the effect. Maybe you can start with one drug and then give another drug, it may be beneficial. This is an example of a crossover design. Okay. So here, experimental epidemiology is the control of most bias, tight control on exposure and the treatment, and high internal validity is there. Disadvantage is time consuming, expensive, resource intensive, non-compliance, that the patient may refuse to take the medicine or whatever and drop out. You cannot, when you're doing the analysis, you find a lot of people have dropped out of studies. And there are ethical constraints. Now, what is the ethical constraint? Ethical constraint is one of the major things. You know that there's a possibility of a side effect, but you are still giving a drug. Is it correct? It's not correct. So that is ethical. For example, when we were studying, I don't know whether you've studied also, there's a drug called thalidomide. Have you heard the name thalidomide? Thalidomide, naam suna chalo. Have you heard the name of thalidomide in pharmacology? Have you heard the name of thalidomide? Have you heard the name of thalidomide? Yes or no? Thalidomide? Have you heard the name of thalidomide in pharmacology? Very famous thing. Huh? What happened to thalidomide? Blood cancer use hoy. Aage ki hoto? No. Before that, thalidomide had a big side effect. Phocomelia. Yeah, exactly. Phocomelia. The child would be born without limbs. Okay. That is the ethical concern. But now it is being used again in multiple myeloma and other cancers. Okay. So that is the ethical constraints we are talking about. And this may not be a practice. Then placebos. Somebody mentioned placebos, nothing. It's just a way of making things similar. Give some medicine which looks like the same thing. And people feel better because they are taking a placebo. For example, when we were students again, those were the days when injection was very common. Okay. So people used to come to medical college and they said, so we used to give medicine. And some of the patients, they used to say, Amake injection deve na, injection deve na. So we used to just give distilled water injection. He just wants injection. And some of the seniors used to say, give these. Okay. So they want a particular thing. That is a placebo. Distilled water injection doesn't do anything. And the patients used to come, both North Indian patients and Bengalis. They used to say, suya nahi milega. If you go to Bihar, even now they want injections for treating most ailments. So that is like a placebo. So we used to give just we used to give distilled water injection at times. It was just a placebo. He used to feel happy. Injection PHA. Okay. That is a placebo. Whether is it ethical? It is when there is no successful treatment, a placebo is ethical, but withholding a treatment is not correct. Okay. Somebody's got some cancer and you're giving a placebo, that is not correct. Okay. Using a placebo instead of the experimental drug is ethical since the experimental drug is not known to be beneficial and could actually be harmful. So here is a sort of contradiction. First is when there is no successful treatment, a placebo is ethical. When using a placebo instead of the experimental drug is ethical, since we do not know whether the experimental drug has got any side effects or not. Okay. So here, that is the question, placebo, whether it's ethical or not. And here again, ethics, withholding good treatment for disease is unethical. And exposing people to possible known harm is also unethical. That means, in other words, you're trying a new drug which can cause side effects and that can, it's difficult to prove it, but that is unethical. So types of RCT, usually clinical trial, evaluates therapeutic agents, interventions, mainly drugs. This is not possible always. Like for example, blinding surgery, tonsillectomy, okay. Pharmacokinetics in volunteers. So you are a group of, you have phase 1 trials, that is volunteers come forward to take test a new medicine. Phase 2, does the drug actually have an effect? Volunteers are coming and they are free from any disease. Phase 2 is when does the drug actually have any prima facie have an effect? Phase 3 is RCT. So this is the whenever a drug is manufactured, new drug is manufactured, they do the experiments on rats, guinea pigs, whatever. Then they first start out, they take a group of volunteers and they give it. Second is they test whether it is actually good, have any effects. Third one is the randomized control trial, after which it is fully marketed. Okay. And phase 4 is post-marketing service. So whenever new drug is brought out, first thing is you test it in volunteers, then you see whether it has got any effect. Third is randomized control trial, and fourth is post-marketing study. Preventive, this was the clinical trial. Second is preventive trials and trial of vaccines and chemoprophylactic drugs. Can you name any vaccine which is just being rolled out? We have yet to see the effects, but it takes some time. Which vaccine? Huh? New vaccine, a very new vaccine recently, which has come out, maybe a month or so in Canada, in West Bengal, in India. Which one? HPV vaccine, yes, exactly. But we do not know the effect yet. We will know only after 5 or 10 years whether the incidence of cervical cancer is controlled. Now we are taking the vaccine, we cannot know the effect straight away. So that is a trial of vaccine and chemoprophylactic drugs. Risk factor trials, the investigator intervenes to interrupt the usual sequence in the development of disease. For example, coronary heart disease, risk factors are cholesterol, high BP, and promotion of physical exercise. So, if you can reduce the blood cholesterol, if you promote physical exercise, the chance of coronary heart disease is less. That's called a risk factor trial. Cessation experiments, usually like cessation of smoking is one. So one group, in a RCT, one group stops smoking and the other continues to smoke. Here again, there's an ethical issue involved. You are allowing the control group to carry on smoking. Okay. Then trial of etiological agents. Your retrolental fibroabrasion, retinopathy of prematurity. In newborn infants, this experiment was done in the US. Premature babies were divided into experimental and control groups. Experimental group, they received 50% oxygen for 28 days. Control group received only oxygen in emergency. And what are the results like? The retrolental fibroabrasion developed only in the experimental group. That is, those who got 50% oxygen, they developed retinopathy of prematurity. Okay. So this is the trial of etiological agents. Premature babies was the population studied. All groups received 50% in the experimental group. Control group received only oxygen during emergency. And this retinopathy of prematurity, ROP, developed only in the experimental group. Again, RCT proved that domiciliary treatment for pulmonary TB was as good as hospital or sanitary treatment. Now, previously for TB, somebody would be sent to the hospital or sanatorium, but now they're saying that you can give medicines, it will be cured. This is an example of a evaluation of a health scheme. Okay. Non-randomized trial is when used for diseases where frequency is low and natural history is long. Like for example, carcinoma of pancreas, small intestine, also viruses causing cancer. So you have uncontrolled trials like use of pap smear and effect of pap smear and decrease in mortality of CA cervix. Natural experiments before and after comparison. Okay. Now uncontrolled trials. For example, 1920 there was no RCT when pap smear was introduced. Today we are able to say that pap smear actually reduces the mortality of the disease. Okay. Because why? It is detecting the cancer early. So that's an example of uncontrolled trial. Natural experiments. When experimental studies are not possible, but the epidemiologist seeks natural circumstances that mimic experiment. Like for example, 1981, study was conducted in Athens on the effect of acute stress on cardiovascular mortality, excess of deaths from cardiac causes, and external causes on the day of after the earthquake. Here there was an excess of deaths from cardiac causes, but not the external causes. Only due to cardiac causes, not the external causes. Okay. So then you have before and after comparison studies, complementary studies with control, without control. Without control is prior to any procedure. For example, prevention of scurvy among sailors by providing fresh fruits. This is a famous experiment by James Lind. So he provided fresh fruits and thereby avoided scurvy among sailors. With control group, you have, in the absence of control group, comparisons are made for observation before and after treatment, which could be misleading. Here, the epidemiologist tries to utilize a natural control group. For example, if you want to do preventive program for a particular community, you select another community as similar as possible in respect to the frequency and characteristics to be prevented. So if you're doing a study on preventive program on antenatal mothers in, say, Birbhum district, you can do a comparison with antenatal mothers in, say, Bardhaman district or some other district. To summarize the strict follow-up of the protocol, randomization limiting the study to limited number of factors, standardization of procedure and intensive training to the observers. Now, let's give out some examples during Corona time. Use of hydroxy, we had a tough time during Corona because there was no proper treatment. The experimental treatment was being done. So first was hydroxychloroquine during Corona. The protocol was selection of groups. Reference population was the population of Chennai. Representative population was the population at Coimbatore, which was part of its area of Chennai. And randomization was investigate has no control regarding who will be given the drug. Okay. So this was the protocol during Corona for use of hydroxychloroquine. So study group was given medicines, control group was given placebos. Final outcome assessed and recorded. Here there was a major ethical issue, denying treatment to a potentially fatal disease. We are playing with Corona, one group got the disease. I mean, one group got hydroxychloroquine, the other group got nothing. So therefore, there was an ethical issue involved, denying treatment to a potential fatal disease. Here another one, the use of dexamethasone. 2,100 patients enrolled in a trial who received low dose dexamethasone for 10 days. Another 300 received standard care only. So here, the dramatic effect was found that those in ventilator risk of dying reduced by 1/3 and risk reduced by 1/5 in patients receiving oxygen. So this showed that dexamethasone was good again when compared to standard care. Again, here was a question of ethical issue. You have denied the other patients the thing. Okay. Then preventive efficacy of vaccine during Corona. Here again, if you look at Corona, there were other things. Reduction of risk factors. How did Corona go? Not only vaccine. Here you have other things also. Reduction of risk factors like comorbidities, travel, close contact, etc. Now, this is the real. Before and after Corona, number of cases increased after international flights opened and trains started running. Okay. So there was a lockdown. After the lockdown again, it opened up. Number of cases increased again. And after flights opened and trains started running. We talked about this. Stress by Corona contribute to Corona causing hypoxia. So here again the same thing. There can be excess of deaths due to stress, not necessarily due to the cause. Okay, so now I just basically the same thing, but now this is slightly difficult. Smoking of 30 to 40 cigarettes per day causes lung cancer in 10% of patients of smokers after 20 years of exposure. Same thing we are going over it. Experimental epidemiology in 1920s, we had epidemics among rats, among colonies of rats and mice, and now we are talking about RCTs. Okay. So animal studies were the hallmark, but not all animal studies fit into human studies. The metabolism of humans can be different from animals. Okay. Advantage is that experimental animals can be inbred in lab, manipulated easily. But not all of them reproduce in animals, and all conclusions in animals may not be applicable in human beings. So human experiments, we had famous experiment by James Lind, Edward Jenner and Goldberger's experiment. So here the benefits of the experiment has to be weighed against the risk involved. Very important, the volunteer should be told that the risk is there, and when an illness is fatal and the benefit of treatment, it would be ethically acceptable to prove or disprove the therapeutic value of blood. Okay. So here is a big ethical issue here. The volunteer should be aware of the possible consequences of the experiment. And here, when it's fatal, you cannot deny or give somebody blood just to prove or disprove therapeutic blood. So now we have RCT, non-RCT. RCT, we have talked about it. Now this is one example of RCT, long time back. All who drink this treatment recover in a short time, except those who do not help, who all die. Therefore, it's obvious that it fails only in incurable disease. This is a statement by a person called Gallen. What he's saying basically is that this medicine works for most people. It's obvious that it fails only in incurable cases. I'm giving a medicine, it will work in 90% cases, whatever cases, but it fails only in incurable cases. That is what he's saying. All who drink of this treatment recover in a short time, except a few cases. Another person called Francis Galton, he said that many people believe the prayers answer a lot of questions. You pray, your disease will go. So, are prayers answered or are they not? Do sick people pray or are prayed for recover on the average more rapidly than the others? This is a question which Francis Galton said. Prayers, if you pray, whatever you pray, you go to the temple, you go to the mosque, you go to the church, you pray wherever, are prayers answered or are they not? So they did a study, but in 1965 they did a double-blind study of efficacy of prayer. 1988 they did a randomized blind controlled CC also. So that was an example of whether prayers answer or not. Then this was the famous Scurvy case by James Lind, who was a Navy surgeon. He took 12 patients in the scurvy on board and he gave them one common diet. This is a diet he gave. He ordered a quart of cider, two others took elixir vitriol, two others took spoonfuls of vinegar, two others had 2 oranges and 1 lemon, and the most visible effects were perceived from the use of orange and lemons, which contain vitamin C obviously, and one of them were taken being at the end of 6 days fit for duty. So in other words, he's proving that the use of orange and lemon was very good, and two of them, one of them joined duty after 6 days, other one was appointed nurse for the rest of 6. So this was the actual experiment which he did. This we've talked about this. Clinical trial, field community intervention trial, community trial. So first one, as I said, James Lind, he randomly assigned 12 sailors to 6 different treatments. The 2 patients who were given lemon and oranges recovered most quickly, suggesting a beneficial effect of citrus. So he was random allocation was done, and so this is again the definition of the randomized controlled trial by John Last. It's a gold standard, makes study groups comparable, prevents selective bias. We've talked about this. We've talked about this also. Experimental population is taken from the reference population. The experimental population is the actual group in which the trial is conducted, representative of the reference population, and possibility for accurate follow-up. So this is study population, reference population is this, and this study population. That is, study population is a small group of the reference population, subgroup. Okay. So participants must be fully informed of the purpose, procedure, risks and benefits, willing to participate, and inclusion criteria and exclusion criteria are taken. Randomization, study in control groups. Random is by chance. Each sampling unit has the same chance of selection, and it's the heart of the study. Both groups should be alike with regards to certain variables, best done by using a table of random numbers which I showed you earlier, to ensure compatibility and to avoid selection bias. Experimental group, control group, that is the intervention. Example, drug, vaccine, habit. Control group, no intervention, usual care or placebo. So, you are doing just a no intervention or a usual care or a placebo. So, your follow-up is over a period of time, you are assessing the persons, maybe after 1 month, 1 year, 5 years, whatever it is, until the final estimate outcome. Attrition is there because some people develop side effects, some people don't take the medicines, they don't withdraw the consent, in between they go to homeopathy, Ayurveda, whatever it is, health issues. So that's why this is non-adherence there, this attrition is also there. Okay. And assessment is the final as a positive and negative effect. What is it? So, study design, this is the study design. We talked about the study design earlier. Treatment A, parallel study, treatment A, treatment B, crossover study participants randomized, some of them get treatment A, And after a few days, treatment is. Intervening period is called a washout period. Now, what do you mean by washout period? You are giving a standard your treatment for, say, a drug to reduce cholesterol. To know the effects that will reduce cholesterol, it will not happen within one day. You have to give some time for it to develop. That is called the washout period. So, treatment A you are giving, and then you are giving a small period, say 1 month before you start treatment B. Okay. So, this is again crossover design. We have talked about this. This is a clinical trial, use of beta blockers in reducing cardiovascular mortality. What is it? Can you name a beta blocker? Any beta blocker? Name a beta blocker? Huh? Metoprolol, okay, metoprolol is one. So, evaluation of beta blockers in reducing cardiovascular mortality. Preventive trials, a trial of primary preventive measures like vaccines. Okay. Then risk factor trial, investigate trials to reduce the sequence prevention of coronary heart disease using clofazimide to reduce cholesterol. So, he is reducing the risk factor. He is not reducing the disease, he is reducing the risk factor. Cessation experiment, as I said, cigarette smoking and lung cancer. Evaluation of health services. Domiciliary treatment of TB is as good or better than hospital treatment. Unique problems of intervention studies are ethical issues, cost and feasibility. So, this is a field trial. It may take a long time. Okay. There is one type of intervention study designed to evaluate prevention strategies. They carried out on people who do not have a particular disease but are considered risk. These are also referred to as preventive studies, and this involves evaluation of whether an agent or procedure reduces the risk of developing disease among those free from the condition and enrollment. And here it involves healthy people, so it's more difficult to carry out than clinical trials. Field trial is in the field on groups of individuals, it may be a household, a block of houses, a school or a whole community. Here the community is a unit of allocation. When the community is the unit of allocation, it's called a community trial. So, for example, this is another thing, a particular community. The exposure is given to something. For example, vector control to reduce malaria, pit latrines for clean water, reduce workload, and to increase disposable income. So, community intervention, community trial. So, for example, mainly nutrition food programs, feeding programs, weaning foods, fortification, nutrition education. The other thing is non-nutrition, immunization, sanitation, economic, labor saving, and the other is integrated. So, ethical and administrative reasons for which RCT is not possible. Direct experimentation is not possible. For example, smoking and lung cancer. Some preventive measures can only be applicable to small groups. When disease frequency is low and natural history is long, cervical cancer again, you cannot do an RCT. There is a crude approach, degree of compatibility is low, validity becomes extra statistical judgment and other things. So, non-randomized thing we already talked about this, I won't go further into this, the natural experiment, cigarette smoking, natural disasters, etc. Before and after comparison studies, James and Scurvy. Now, one other thing is wearing of seat belts. Has wearing seat belts reduced the number of accidents? We look at this in 71. In 1971, there were 564 deaths due to injuries. But in 1970, what happened was 464. What happened was that they introduced the seat belt. Here again, in 1970, we had other states, they had more, 1,429, because they did not introduce the seat belt. So this proves that wearing a seat belt has reduced the number of accidents. Okay.